Hi everyone, I welcome you again to this day and this season again as we are here with Talking Hands, Listening Eyes on postpartum depression. My name is Judy Kihumba. I'm so excited today and grateful to all who have been watching us, who have been following us, who have been asking questions, who have walked this journey with us. We are here to talk about child loss and grief, and especially to the deaf people, because we've realized that as hearing people in the hearing world, we have so many ways of comfort when we are going through child loss, but for the deaf mothers, sometimes they don't get the right words. Maybe they are not even comforted. Sometimes we think that nature will just take its course and they just get comfort. But we are here with Gladys, Nyawera, and Hellen, who will tell us more about their journey. And Hellen is a sister to Gladys, and she's here as a caregiver, as a person who has worked with a deaf person who has gone through loss, and how they have supported her, and how maybe we need to learn how to comfort others, and the do's and the don'ts, and also even the maids that are there with child loss, especially in the deaf world. So thank you very much for your time and for listening to us. I'm sure this will be a journey and will be a learning experience from the story that Gladys will give us. Thank you very much, and I want to welcome Gladys. Gladys, you're welcome to THLEP, Talking Hands, Listening Eyes. We are here to talk about deaf mothers. And maybe you can introduce yourself and tell us, who is Gladys?
My name is Gladys Nyawera. My surname is G on the side of the face. I am a deaf mother. And have a child. But my firstborn son is there, but my secondborn passed away. From which sickness, I don't know. Yeah.
Thank you.
I'm getting uncomfortable, maybe. I feel like I am fearing something, but it's okay.
Okay, and it's allowed. Even if you feel like crying, it's allowed.
When I remember, I feel like, when I remember, I am overwhelmed.
Yeah, it's allowed and it's okay. Hellen, how are you? Tell us more about Hellen and who is Hellen?
Okay, thank you so much for welcoming me. My name is Hellen Wanjiru Kiregwe. I'm Gladys' younger sister. I have a daughter and I work at Westlands. I'm in the hospitality industry.
Wow, thank you very much for honoring this invite and for coming. You're here not because we want to expose the story, but we want to get to know from your experience, from Gladys' experience and from your experience, how we may help other people. Sometimes the things we go through for us to learn and to help others who may be on the same journey, how we can help them walk the journey. I'd want to ask you first, because I would want to ask Gladys whether she's okay. I asked her a question. Is she okay? Perfect. So, yes. Gladys, you said you have one big son. How old is your son?
9 years old.
He's 9 years old.
He's in class 3 right now, still continuing at school.
He's deaf or hearing?
He's hearing.
Oh, he can hear. Good. Now, tell us, how was your journey?
I have a question. When I went to Kenyatta, I gave birth well, but when I carried to my sister's house, it just happened that the first story, my brother called me and told me, I don't know what is happening with your baby. You have left your baby. What are you doing? So when I went, he told me there's something wrong because maybe I'm deaf. So when I went and I checked and Hellen was there with me, they confirmed that the baby was dead. I had told her the baby was dead, but she refused. She said, no, the baby is not dead. So we had to go to hospital, and the doctor said that the baby had already passed away. So for me, I cried for a long time when I remember that baby. So when I carried the baby home to Moranga, when it was on a Wednesday, when I saw the body, I was shocked that my child was dead, and maybe I thought maybe it's because people are jealous of the baby.
Gladys, I want you to walk with us through the journey of when you knew you were pregnant. When you were pregnant, when you went to the hospital for the first time and the doctor told you were pregnant, how was it? Did you go for clinics as normal, or did you go for clinics? Are you going for the normal clinics every month? You're going to the...
Yes, I used to go, but I would not hear the baby kick. So the doctor checked, and they said that the baby is growing. So they said it's better I go for a cesarean section. And then they carried me, they did a scan, and then when we went, it was fine, it was all fine. Yeah, it was good.
Why did the doctor say you needed to give the birth through cesarean?
So I think I would answer that. They said that my vagina was a little bit small. It would not be enough because I had not done enough practice.
Okay.
Yeah.
Hellen, when Gladys came home and told you now, with the second baby now, that she jumped to the second baby, that she's pregnant, how was your reaction?
First of all, I was shocked because apparently she had added so much weight and we didn't know she was pregnant. So we had to confirm. Actually, I think her colleague, or rather her boss, called me and told me Gladys is not feeling well. She needs to go for a checkup. So we're like, okay, what's the problem? I asked her. She told me the HR told me they have given her a few days. She go to the hospital and then come back with the report. Then we went to some clinics. I can't remember the name.
It's okay.
We were confirmed she was pregnant, and apparently it was almost 6 months, and we didn't know. So from then she was shocked. She started crying. She didn't know what to do because we hadn't done absolutely nothing.
So she learned she was pregnant when she was 6 months pregnant.
Yes, heading to 7, and it wasn't even showing. But she had really added lots of weight. So I was also scared. How am I going to tell mom? Okay, how are we going to start about all this? It was difficult at that time because she even said she wants to remove it. We told her, no, we can't. Regardless too, we'll just give you some time, go and rest. Mingine tutaongea baadaye. So mom called, then they talked. It was also hard for her again. But to accept.
So, how did you convince her not to abort the baby, especially that, do you know sign language, or how is your communication normally at home?
I know a little bit of it, the basics. So with the basics, I could do everything.
Perfect.
Yeah.
And you worked now the remaining months, every month to the clinic?
Every month.
You took her to the hospital? Okay.
Yeah, we went to Aga Khan, and then the docs at Aga Khan told us to go to Kenyatta. So tukaenda Kenyatta. Yeah, it was awesome.
How was her communication with the nurses there?
They were writing. She was writing. The doctor was, as in both of them were using writing.
They would write to each other. So there is no single time that you used an interpreter per se. It was just them writing.
No.
Okay, Gladys, how did you feel when your sister talked to you that you can keep the baby, we are ready to walk the journey with you? Of course, when you are saying you want to remove the babies because you are scared and you didn't know how they will take you, whether they will accept or what will happen. How did you feel when your sister Hellen told you, it's okay, let's take care of the baby? How did you feel?
Well, I felt good.
You felt good?
Yeah, I never felt bad. But previously, I was ready to abort because my sister came and told me, no, you can't do that. So I was just patient because she told me God will be so angry with me if I do that, I'll destroy my body. So I was just patient and give birth to the baby, and I was happy.
Wow.
Yeah.
So from her, if you were alone, you would have made a drastic decision of aborting if she wasn't around you or if she didn't talk to you.
Yes, I would have aborted.
So we thank God that she helped you walk the journey with you. And now tell us, on the day that you gave birth, how was the journey? That specific day, the day you went to the hospital to give birth, how was it?
Well, I felt good. It was a good day.
Did you go through normal labor pains, or the doctor had given you a scheduled day?
Hey, I had a lot of pain. It was a lot of pain. I want to give birth, but I felt a lot of pain. Yani seriously, serious pain.
Wow.
Yeah.
So, tell us, did the doctor tell you, now without your sister, the doctors tell you that you are going to go through a CS? The doctor explained to you? How?
Yes, they did.
How? The doctor wrote to you or called an interpreter to interpret for you or your sister?
Yeah, he just wrote to me. But they never explained clearly. They never did a lot of explanation. They only wrote something shallow, you know. It was not something that I would understand.
It wasn't
myself,
clear.
Yeah.
So you knew about the CS from the doctor, yes. But the baby was okay? When you gave birth to the baby, the doctor showed you the baby and the baby was okay?
Yes, the baby was fine. But the doctor told me I have to care for the baby well. So for every month, I have to bring the baby to hospital for the next 6 months so that they can check the body and how it's functioning. So I was just shocked that they said that they had just a little cold or some pneumonia.
Okay.
Yeah.
Helen, could you walk with us? I'm sure you're the one who walked with her to the labor day, to the labor ward.
Apparently, hiyo day ya labor,
Yes.
I wasn't there.
Uh-huh.
But I was going there every time. She had a friend mwenye alikuwa amelala tu hapo, so tulikuwa tunaongea naye like, hi, how is she doing? She's doing well. And then kesho, you guys bring this and this. We're like, okay, fine. We text, we chat, video calls and all that. Yeah, it was awesome. And then around 12 a.m. we're told she's gone to the ward, to the theater for the CS. Okay. Story of CS, it is because previous...
She had another scar.
Yes. Okay. No, she had another CS.
Yeah.
So the doc said, badala all these, let's just do the same
Do
thing.
another scar, of course.
Yeah.
That's what they say. When you have a first scar, mostly they want to continue with the same scar.
Yeah.
Okay. Can you take us... no, you were not there when she was going through she was going for the maternity leave.
Yeah, that night I wasn't there. We went there the next morning.
But when you went to see the baby was okay?
Very fine, very fine.
And how long did you stay with the baby?
From the moment he was born on 30th 09 2019, and then we went home after 3 days. So we stayed with the baby for like, I think 18 days only.
Yeah, I think it was on a Thursday where I carried the
days.
baby. Yeah, I brought the baby home. And then later on, still continued carrying the baby to hospital, but they just said you're just a little cold. So Helen would help me go. The doctor would tell the body that the baby is okay. It's only that the baby has a little cold. But as we continued, we don't know what happened, and we don't know what happened, and then they died on Friday.
Okay. Helen, within the 18 days, between day 1 to day 18, how are you communicating with Gladys in terms of she needs to breastfeed the baby, she needs to... Of course, with her experience that she has another baby, it was not as hard.
Yeah,
but were there any challenges that you'd face to communicate to her about the baby in between the 18 days?
No, it wasn't hard because we were already used to. She has also been with my daughter, so the whole journey it was one easy one. Then we also had a house help who would also help me when I go to work. It was just easy. It was easy.
And at night, if the baby, you know the way that the baby sleeping patterns change. For her, who was waking her up?
Imagine she had that feeling.
She would wake up by herself.
Yes, and just check then continue sleeping, wake up,
She
check.
kept checking.
Yeah, whenever I hear maybe the baby has cried like 2 times, that's when I wake up. Because we were
Okay.
sleeping. Now I had to give her my bedroom,
Yeah.
move to the sitting room and
Yeah.
let her and the baby and Ron too, like the 3 of them. Because
Yes.
Ron was really so much attached to this
To the
young
baby.
boy. Yeah. So even Ron would wake her up like,
Oh, check on the baby.
the baby, yeah.
Wow, wow. So on this day, the day that the baby died, was the baby sick?
Yeah.
Uh-huh.
What happened is the baby after kitu like 15 days hivi, the baby was sick. He had a homa, then he had fever. He was a
No,
little
the
bit-
baby had only a cold, not anything very serious.
Yeah, it wasn't that serious, but since he was a newborn, didn't take any chance.
Yes.
We took the baby to the hospital, to Penda Hospital. So the doc checked, kasema, it's normal, but we'll give some medicines. So we're like, fine. After we left Hosi, the day the baby took the dawas and he was fine. He was fine. Day 1, day 2. Now day 3, when we are going to finish the dose, I woke up, fed the baby, gave him the dawas and all that. Then I left him sleeping. And then I told the mom not to go and sleep because now I'm around. I'll be working at around 2 p.m. I'll leave when I've done everything.
Yes.
So that morning, it was around 6 in the morning, the kids came and played the baby before going to school, and it was good. Then the mom slept. I transferred the baby now from where he was to now the main bedroom, because now she brought the baby so that the kids can like
Play with the baby.
a little bit before waende shule. Hiyo time atoi walienda shule, and then me I was now preparing for work. Now it's around 10. I mean, I was not for work. I was preparing, doing my own things in the house.
Yes.
Checked on the baby. I think he was not moving at that time. I tried tickling the feet. He was not responding. Tried doing some stuff. He was not, but he was still warm.
Yeah.
But something came into my mind like, umtoi hayuko, he's gone. But I couldn't let that thought ingie kwa mind. Like, I said, no. So nikachukua mtoi, because it was a struggle, like, she's seeing what I'm doing, the house help is there. So I just took the baby, went and dropped him in the bedroom. Kumdrop kwa bed, nikamfunikia tu, nikamaliza shughuli zangu. Now it's around, that is 10, now it's around 1 p.m, bado mtoi amelala. But bado, there's something that's disturbing me. But I can't really tell what's the problem.
And at that point, you've not even told her.
I've not told anyone.
And even her, she has not thought of coming to breastfeed the baby.
No, that time she's happy. At least the baby is sleeping, and now she's resting.
Oh.
Yeah. So at around 1 p.m, my brother came. No, that time I was preparing to go to work. Niko busy kwa kioo, makeup, blah, blah, blah. Then my bro, he was like, he was used to, before even him going to his errands, he will come, go to the bedroom, play with the baby, kidogo kumwangalia. Yeah. So that time, my bro came. He's like trying to play the baby. The baby's not responding. But mimi kwa kioo, I can see what he's doing. But in the back of my mind, there is something wrong. But I don't want to expose or say anything.
Yes.
So mimi niko kwa kioo, naona tu vile akaniita akaniambia, we, hebu kamwangalie mtoi aongee. I'm like, I mean, move. Like, awe wacha kusumbua mtoto, nitamchukua nikimchange diaper, ndio tushughulike naye, ndio nisimuache. The second time akanita nika ignore. The third time, no, that's when he raised the alarm, like, yo, umtoi. Kuwa serious. Now get serious. Hellen, stop wasting time.
Yes.
Kama angalia mtu. Sasa akili sasa ikasema huyu. Naye kumbe hata ame read signs. So naye pia hata ikuniambia. So we are there like, okay.
Both of you, and you've not even told the mother.
Tuko hapo tumeangalia tukaulizana nao wote, kabidi nimemtoa socks, mguu zimetana imekuwa blackish, uso imekuwa pale, mkono there is none. So like I got shocked, so scared, tukaloko mlango kwanza. Kuuliza, oh my God, what are we going to do? Tutaenda kumwambia nini?